Good morning, everyone. My name is Tengku Laras Malahayati, and today I will present about how Taiwan cope with COVID-19. Nowadays, the world is facing an epidemic that threatens human life that is caused by coronavirus disease. Coronavirus disease 2019, COVID-19 is defined as illness caused by novel coronavirus called severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, which was first identified in Wuhan City, Hubei Province, China. It was first reported to the World Health Organization (WHO) on December 31st, 2019. On January 30th, 2020, the WHO declared coronavirus to be a public health emergency of international concern due to the significant increase in confirmed cases in various countries around the world. Later, on March 11, 2020, the virus has infected more than 50 countries in the world and caused a huge number of deaths. Therefore, the WHO declared the world pandemic, COVID-19 pandemic. From this picture above, we can see that one of the 4 countries has less COVID-19 cases, which is Taiwan, Republic of China, ROC. When the first COVID-19 case was confirmed in China, some people predicted that Taiwan would face a spike of confirmed cases. Despite its location near China and the frequent travel that takes between these 2 countries, Taiwan proves that the situation they're facing is the opposite from the prediction. Why? Let's take a look at this graph above. The secret of Taiwan's success lies in the painful memories of the severe acute respiratory syndrome SARS outbreak in 2003. With the history of the SARS pandemic, which was not considered to be handled particularly well, the Taiwanese government immediately closed its borders and set up a central epidemic command center on January 20th, 2020 to coordinate cooperation across different government ministries and agencies and between government and businesses in order to prevent the spread of the deadly coronavirus. First, people started to use face masks, while the authorities focused on hospitals and monitoring movements there. A 14 days quarantine is required for all arrivals. Authorities even closed entertainment venues and some educational institutions to control people movements. Taiwan's capacity to deal with this outbreak was also much greater than in 2003. Second, hospitals across Taiwan prepared 2,000 beds in isolation wards, and there are also more than 20,000 beds for those with mild symptoms, and the government gave incentive packages to encourage frontline health care workers. Last but not least, most public activities such as restaurants and malls were still open, but with strict health protocols and few visitors. How do these work effectively in Taiwan? A new study in the Journal of the American Medical Association examined further why Taiwan did so well facing the pandemic. The study's authors compared the estimated effectiveness of two types of COVID-19 policy in the early months of the pandemic: case-based and population-based measures. Case-based measures included the observation of people through testing, numbers of positive cases, contact tracing, and 14 days quarantine of close contacts. Meanwhile, the population-based measures included face mask policies, personal hygiene, and social distancing. The effect of these policies were quantified by estimating the effective reproduction number, R number, which represents the average number of people that one infected person will pass the virus on to. The greater the R number than 1, the faster the spreading the virus, and the outbreaks will still continue. An R number below than 1 means the case numbers will start to reduce. The study found that the case-based policies alone could reduce the R number from 2.5 to 1.53. Quarantine contributed the most in reducing the number. This policy could not significantly prevent transmission of the virus from one to another, but it could reduce transmission frontwards to the third or fourth person, as long as close contacts were quarantined. Population-based measures like social distancing and face masks reduced the R number from 2.5 to 1.3. In conclusion, the combination of case-based policies and population-based policies, along with the excellent cooperation between the government and the public, led Taiwan's success in facing COVID-19. Combining both approaches led to an R number to be 0.82 and as low as 0.62. Even with an effective public health system and advanced contact tracing, neither approach would have been sufficient alone. Hope you all stay safe and stay healthy, everyone, and thank you for listening my presentation.